I'm David Feldman. This is the Mop-Up. Joining us is the Reverend Barry W. Lynn and Dr. Joanne Lynn. We're going to talk about an important subject that we neglect, and because we neglect it, they take advantage of it: hospice care. If we're lucky, we get to experience hospice care. If we're lucky, it's an uncomfortable topic. Before you introduce Dr. Joanne Lynn, the Reverend Barry W. Lynn, what does hospice care mean? What does it mean?
I think the original intention was that there ought to be an alternative for people who are willing to give up certain things, and we can get in that with Joanne, but so that people could be comfortable in their last 6 months of life, giving up any desire to be cured. Simply they wanted their pain managed and so on. And most of it would take place in your home, so you wouldn't be subjected to all of the unnecessary strangeness of America's hospital systems. It was started in Britain, and now here in the United States, it has been not totally, because there certainly are some good hospices, like there are maybe one good political action committee. But in general, it's just it's just been corrupted by corporate interests who have a lot of interest in making money and very little interest in caring for the patients.
Right. I saw it with nursing homes, elder care with my mother. It's a for-profit industry, and they're trying to save money, not lives. Please introduce Dr. Lynn.
All right. Well, this is Joanne Lynn, my spouse of a very long time, 52 years, and she's been working in elder care and hospice for most of her professional life.
She's a medical doctor.
She's a medical doctor, and not that there's anything wrong with being a doctor of something else, but she is a medical doctor and fully licensed to practice. And we talk about this a lot over dinner, and but she knows lots of stuff, and I'd like to just introduce her right now. Joanne, where did hospice begin, and was I more or less correct in defining what it started, what it offered at its beginnings?
Well, hospice in the modern era, hospice actually was something back with the Crusades, but in the modern era, it was started in England in probably about 1980 or late 70s. By Dame Cicely Saunders, who was a social worker, then a nurse, then a physician, covering all the bases. And in Britain, it was mainly in institutions and mainly supported by philanthropy, although now the National Health Service does pay some of the cost. But when it came to the United States, it was mostly in home. And started here in probably about 78, maybe 77. I have been said to have been the 6th or 7th hospice doctor in the country, and I started in 78.
Where did you start? Just tell people the kind of place in which you decided this was something you wanted to do for much of your life. What was the place?
It was a 6-bed unit at the Washington Home, which is a big nursing home in Northwest Washington that was kind of the grand dame of Washington long-term care. A very good nursing home. Took 6 beds at the end of a unit and made it a hospice unit. It was all inpatient, following the British model at first. Later on, added home care. It was, I started in 78, but I actually got into it because I was looking for a way to kind of be a doctor while teaching ethics at George Washington University. And I had been sort of doing a triangle of a clinical office in Southern Maryland, teaching in DC and living in Northern Virginia. And then the oil embargo hit, and all of a sudden it was very hard to travel an hour on each leg of this triangle. So, and at just about the same time, the practice I was managing in Southern Maryland was able to be sold. So I consolidated myself to George Washington, and I was just a general internist. And it turned out that the two geriatricians who had started the new geriatrics program could not stand the hospice program. In fact, one of them could not write a do not resuscitate order. The other one could, but had a hard time with it. So the hospice just gave them hives. And so I was assigned to take over the hospice unit. All of the nursing home patients who had no prospects of leaving, and the clinic patients who had already been seen by the geriatricians and had nothing to improve. So basically I was dumped on, and it was wonderful. It was exactly what I wanted. They were great nurses, great aides, terrific people. I mean, even in the nursing home, the tenderness and devotion of the aides to their residents was just remarkable. And I just truly loved it. But, I was working in a group that couldn't stand it.
Do you mind if I ask a question about this?
Please.
Oh, go ahead.
When you're younger, this sounds terrifying. When you're older, it's incredibly terrifying. And yet those who have experienced it can often walk away from it saying it was a tragedy. It was a beautiful tragedy. That there are people who facilitate this and provide a lot of comfort. They almost stage the end, and it can be, I know it's hard to believe, it's not what we want, but I remember Queen Elizabeth said of Prince Philip's departure, it was absolutely beautiful. Why do people say that? Let me ask Reverend Lynn, why would Queen Elizabeth, I know she loved Prince Philip, but why would she say it was absolutely beautiful?
Well, because I think most of us who think about death or who have been involved with close family members or doing chaplaincies, as I did early in my career, people do need a comfort as they start to realize that they are about to die. And it helps if you've talked to lots and lots of people, and that you can provide, as a nurse, as a doctor, a social worker, a minister, a rabbi, that you can present them with some sense of calm before they die.
As well as the loved ones.
Exactly.
Well, David, in underlying the sort of, as you describe it, the fear that young people feel and people feel maybe as they get even closer to getting older and dying, our culture has a tremendous arrogance about this, don't you think? I mean, why don't we talk about the fact that it's a remarkable gift that we should live? I mean, my mother, who was a doctor, always said, it never surprises me that people die. It surprises me that with all of the possibilities, we should live.
Your mom was a doctor?
Yeah.
Well, what kind of doctor, if you don't mind my asking?
She was a general physician until I was in high school, when she went back and got radiology certification. So she became a breast cancer radiologist.
Wow.
But, in earlier cultures, in our own traditions, there was much more recognition that life was tenuous and that it was a gift to have every day. And in that kind of a context, living well as long as possible is a wonderful goal, recognizing that it is always as long as possible. I mean, we don't want a Shakespearean play to go on for indefinitely. We are pleased that it ends after 4 or 5 acts. And in the same way, our lives have their course. And at the time that hospice arrived, there was tremendous arrogance and enthusiasm for medical care. So people who chose hospice in the late 70s, early 80s were thought to be very weird. And
you're talking about the doctors and the nurses who chose.
No, the patients.
Oh.
Because they were giving up on the possibility that there would be a cure around the corner and they would get to live longer.
Yeah, why don't you explain the two things about hospice that in theory are still required? One is this idea that you're giving up any efforts at curative work. Well, I don't know, whatever that means. And then second, that you had a prognosis of living no longer than 6 months. But both of those really have no meaning because they're kind of undefined legislatively or through regulation. Am I right?
Well, they have the meaning that each hospice gives them and hospice as a whole. So the giving up on curative treatment has come to mean not to have expensive, intrusive medical things happen. And it doesn't really mean curative, because obviously if there was something that truly could cure your condition, nobody would take hospice. But so it has to mean something. And the meaning that it practically has is that you are giving up extensive surgeries, risky chemotherapies, very expensive drugs. And
for just a couple of extra months.
Well, yeah, I mean, until recently, the average length of a hospice stay was 2 weeks. Now that more and more hospices are taking in elderly people with degenerative illnesses rather than cancers or something like that, the average length of stay has extended to maybe 6 or 7 or 8 weeks. It's never been anywhere close to 6 months.
Doctor, do we see any analog with the right to life movement and hospice, that the people who call themselves pro-life would be anti-hospice?
Well, there has always been an undercurrent of concern that hospice providers were killing people earlier than they would otherwise have died. So some of the anti-euthanasia folks have been very suspicious of hospice. On the other hand, the Catholic Church, virtually all faith traditions have welcomed hospice, in part because all of the major faith traditions recognize that there is a death in store, and the dying doesn't have to be any more awful than it has to be. So, to the extent that people can be comfortable and supported and their families can be supported, they're very much in favor. That New Yorker article points out that a number of
I don't think we've mentioned the New Yorker article. So what is?
Yeah, there was an article in the New Yorker about, Barry, a week ago?
Correct.
Where you're mentioned, you're in that article.
Yeah. But she did a lot of digging. She found a lot of really outrageous practices. And Barry said earlier that, this has become commonplace. I don't know that. Nobody knows what the rate is of these outrageous practices. The hospice service line is now dominated by a couple of for-profit companies. So everybody worries, without much evidence, I mean, in either direction, that there's a lot of at least sloppiness and to a certain extent malicious behavior going on in hospice circles.
Let me ask you this, though. If if we do know, for example, that people are now searching for elderly people with long-term illnesses, wouldn't it be likely to believe that there's a widespread sense that if we get these people in here and they're here for 8 months, and some people are, we'll just make more money?
Yeah, I mean, if you're running a hospice that regularly has 8-month survivals, you will get in trouble with the feds. That's easy for them to track, and you'll have to pay money back. But if you have, a minority, 10 or 20% of your enrollees doing that, you won't be bothered. But what hospices do is promote people out of hospice when they get to being kind of 5 months and a little. And that is actually terribly disruptive to the patient and family, because hospice is the only place that Medicare provides comprehensive care. So Medicare provides doctors and hospitals and skilled nursing facilities for a short time after a hospitalization, and assuming you signed up for it, drugs, but they do not provide home health aides, and they do not provide, in general, hospital beds, and they do not provide support for the caregiver, and they do not provide bereavement services or chaplaincy services, whereas hospice provides it all. And they're supposed to be providing it all, but most hospices actually exist on relying on the family for doing most of the work. So but it still comes as a package. So when a person graduates from hospice, all of that falls apart, and they've got to go back into the chaotic long-term care system and find a home health agency that will have a person and that is reliable and that they can afford. And then they have to get their drugs delivered, and then they have to find a doctor who'll see them. And, they have to put this whole thing back together. And the person isn't well. They're just surviving too long. So the person is, more and more demented, or more and more stroked, or having worse heart failure, but they just aren't dying on time. And so the fact that we don't have a long-term care system in the country leads to this kind of cycling people through hospice. So a person goes off hospice for maybe a couple of months, and then they run a fever or they fall, and now they're sicker again, and they can go back into hospice.
So you can go in and out of hospice.
Yeah.
Well, what about the person since you said, although most patients are in there for 6 weeks, you could stay 6 months. If you stay 8 months, doesn't the hospice provider say, well, we thought it would be 6 months, but it turned out to be 8? Or in the case of somebody I know personally, the guy's been in a hospice care for 1.5 years. So the feds come in and say, well, we demand money back. Doesn't the response from the hospice say, we just made a mistake, we were told it'd be 6 months? How did he deal with that?
In any one person, that'll be fine. I once wrote a note on consulting on a person who was in a hospice in Washington, D.C. It's a kind of a famous note in hospice circles. The patient was an elderly woman with heart failure, so bad that she had no discernible blood pressure when she stood up. Luckily, she was all hunched over and somehow managed to shuffle around her small apartment. She was in and out of the hospital 2 or 3 times a week before she got into hospice. And hospice put in place a volunteer to call her and walk her through taking her meds, and made sure she had a low salt diet and all sorts of things. And she stabilized. And so, as you say, 8 months in or something of the sort, I was called to see her to give a second opinion on her prognosis. And my note was, this patient has no way to show a worsening of condition without being dead. and one night she went to bed feeling a little queasy and died overnight. And that patient is not going to cause a hospice any trouble. they'll get the second opinion so that they can defend themselves against some snoopy person from Medicare. But what you get in trouble for is having 60% of your people doing that. And there are some hospices that do that has 60% of their patients having 8, 10, 12 months. So all the hospices have gotten savvy. And as I was saying before, they start discharging people at 5.5 months and then picking them back up at 8 or 9 months, especially if they're in assisted living or a nursing home where it's easy to keep track of them because you're seeing somebody down the hall. So you can, so they cycle people through hospice.
For people who are unfamiliar with this, if you're not in Medicare, if you're under the age of 65, what are your options with hospice? And then what are your options with Medicare vis-a-vis nursing homes?
Well, the under 65 insurance, commercial insurance, almost universally covers hospice. They may have a few more constraints, but basically they cover hospice. Managed care covers hospice. They do control it more carefully than everybody else. But so if you're in a United plan or a Kaiser plan or something, they're eager to use hospice in appropriate cases because it keeps people out of the hospital, which is much more expensive. Also, hospice is carved out of managed care. So if you're in a United healthcare plan and you're 45 and you end up going into hospice, the cost of hospice is on well, 45 wouldn't count, I guess, but if you're 70 and you go into hospice, Medicare picks up your hospice costs, and the United now gets a pittance, just $35 a month or so, to cover your non-hospice medical issues. But still, it's so much better deal for them for the appropriate patients. But Medicare does not cover nursing home care. Medicare covers short-term nursing home placement after a hospitalization for something like wound care or
that's I think a lot of Americans deny, as we talked about earlier, that this is going to be a problem, which makes it easy for predators to gouge them because they're not prepared. So if you're past 65 and it's time for you to go into a nursing home, who pays for it?
You do, unless you're poor, in which case Medicaid does. And the qualifications for Medicaid are very different in the different states. So in some states, you have to be really, really poor. And in some states like New York, it's much more generous. But basically, you pay until you run out of money, and then Medicaid picks you up.
And so this is important for Americans to know. We don't think about this because it's not going to happen to us. If
but we also
70% of us need long-term care. 70% of us in old age.
And so is there insurance that you can get for long-term care?
Yeah, but the market's really broken. The long-term care insurance companies made some very seriously bad assumptions back in the 1970s and 80s, and they're still paying for that. So they keep raising the premiums. Indeed, the federal program, which is run by John Hancock Insurance, has stopped taking applications for 2 years because they were just getting deeper and deeper into debt.
So I don't mean to interrupt, but this is something really important that Americans need to know.
Yeah. I've spent the last 3 years trying to get people to understand that what we most need the government to do is to cover long-term care, that it should be on your shoulders and ours to cover a year or two. You should be able to save or buy insurance for the upfront costs. But if you have 20 years of serious disability from a stroke when you're 65, that's the thing that will devastate you, your family, your community. We need a
What does it cost? So let me just spell this out so it's clear to the American people what we're up against here. If you're middle class, upper middle class, and you need to go into a nursing home, what does it cost usually?
The average nationwide is now about $120,000 a year, about $10,000 a month. If you want
$10,000 a month, and it's impossible to get insurance for that.
It's possible, but you have to be pretty rich
to get that insurance. If you don't have the insurance, you have to be dead broke and on Medicaid for the government to pay for your nursing home.
Right. Unless you're a veteran or some other special class, but yeah.
And so if you need to go into a nursing home, if you're all alone, or if you don't have, they will just wind down your life savings.
Yep. It's now the largest cause of personal bankruptcy. Often not declared because the person has no reason to declare bankruptcy if they have nothing. So they don't actually declare bankruptcy. They just quietly go into Medicaid and, lose the family business, lose the family ranch, lose any legacy to the kids that you haven't already given them. And actually now the state is supposed to go back, I think it's now 5 years, to see if you gave away a lot of money. So if you're going to give away something, give it away, 10 years ahead of when you're going to need it. Good luck figuring that one out.
Now, aging in place where you have a home aide who comes and visits, as opposed to being in a nursing home, is that less expensive or more expensive?
Depends on how much you need. About 6 hours a day of paid help is the break-even point. If you need around-the-clock care, it takes 5 FTE to provide round-the-clock care.
What does 5 FTE mean?
Five people, 5 full-time equivalents. So 5 aides to provide around-the-clock care for somebody who has nobody else. Even if you paid them, miserable wages and benefits, let's say $40,000 worth of wages and benefits, that would already be $200,000. And you have the cost of the house, the taxes on the house, the roof repair, the hot water heater goes out, and food and medical care. And, so it ends up being somewhere on the order of $250,000 to $300,000 a year if you need around the clock care. So most of the care in the country.
Reverend, it is unconscionable that this conversation is not being had.
Oh, absolutely. I mean, everybody can't eavesdrop on our dinner table conversations. But yes, this is one of the hundreds of issues that are never discussed in any serious way on even the major so-called news programs, because those news programs are obsessed with making predictions about future elections, making predictions about whether Donald Trump will end up in prison or not, endlessly, and ignoring all of these things. I remember, just to go back a step, Jerry Falwell and I were on a lot of television shows. One month in his magazine, he attacked me, which he did a lot, and even Joanne. So there are that kind of fringe a group that didn't like either one of us. But can
I just interrupt you for 1 second?
Sure.
Because I remember what you said to the Reverend Jerry Falwell. You said, "You can make fun of my wife all you want, but when you come after me,"
yeah, that was pretty much it. That was definitely, I would have said that. I was going to plan to say that to him on a phone call, but then he died. But
let me jump in here, Barry.
Jump in with this.
David, we've only brushed the surface of just how bad this is. we will double the number of disabled elderly between 2015 and 2035 as all the boomers get into the age of disability. By the time we reach the mid-30s, the average middle-class person will not be able to afford housing, food, and medical care. We face having huge numbers of people who lived in the middle class homeless on the street in their 90s. It is.
Well, maybe climate change will take care of that for us.
Well, I mean, part of my concern over medical aid in dying is because of this coming at us. Will we effectively be telling people, do yourself in because we do not care to provide for you? We do not care to feed you or to have a roof over your head. So there's this craziness that with a sweep of my pen, I can write for a $20,000 a month drug, and I cannot get you supper. And we are going to have such huge numbers of elderly people who need supper or need a roof over their heads. And we have a medical care system that has grown corpulent. I mean, obese. Why is it possible that somebody who gets trained as a physician thinks they can earn $300,000 a year right off? And yet, they're dealing with people who cannot get supper. So we need such a rethinking. In 1965, when Medicare passed, and Medicaid for that matter, the average age at death was still under 70. The causes of death were fairly abrupt. So people had, on average, a few years of reasonably nice retirement, and then they had a stroke or pneumonia or a heart attack. We had very few people who made it into their 90s. Now, most of us will make it into at least our late 80s. And most of us will have a long period of disability. 70% of us will have long-term care needs. And we have done nothing to make it possible to live decently in that piece of time.
Build Back Better, Doctor. Bernie's version of Build Back Better.
Well, Bernie's version of Build Back Better has like one sentence that says that we'll cover long-term care. It doesn't have any of the infrastructure of realizing that that would double the cost of Medicare and no way to raise that money. So you have to really get to the nuts and bolts of what are you actually going to do. I mean, Bernie's thing is good as a lightning rod. I mean, it creates conversation, but it's not a practical legislation until you really get to figuring out what are you going to use as the threshold? What are you going to promise? Are you going to promise some kind of a big facility in which, yes, you have a roof over your head and food, but nothing else? It's just bare survival waiting for death? Or are you going to provide small homes with 10 to 20 people served by a small group of aides and nurses? Are you going to continue to provide these incredibly expensive drugs to people who live on the streets in their 80s? We have a new drug coming on board for dementia. No one said yet what its pricing is going to be, but it's going to be incredibly high. It's going to be $100,000 a year to slow dementia by a few weeks, maybe a couple of months. And it will meet all the requirements of the FDA. It will be approved. Medicare will pay for it. And all of our Medicare taxes will go up. And no one is saying yet, wait a minute, give me food first.
Right.
I can't write for food. And
don't take this on an empty stomach.
Yeah.
Well, that's going to be a problem.
Yeah. I mean, it's how can you take care of somebody with diabetes who has to live on the streets? What are you going to do in North Dakota in winter? I mean, it's people have just not thought this through. Why are we rebuilding after disasters? Suburban homes, 4-bedroom houses. We should be building lots and lots of senior housing all on one floor, easy to access the refrigerator, easy to use the stove, no steps anywhere. That's not even in the HUD stuff. Washington, D.C. has a requirement that I think it depends on which kind of building you're building, but 12 or 20% of your apartments have to be disability adapted. They don't have to be given to people who need them. So 1% of the housing in Washington, D.C. is available to a person in a wheelchair. And, we aren't even, as you say, we aren't even talking about it. We need to have a way in which a decent working person in America does not have to be terrified of what will happen to them when they're 80 and 90. And it's mostly a women's issue because men cleverly married women a few years younger.
Mm-hmm.
And the women do the caregiving. But then the woman's all alone. Half of the women past 85 have no one. So we are the ones get dumped into nursing homes that are wholly inadequate. And where's the feminist argument for this? Where's now? I mean, the degree to which we have ignored this and essentially colluded to try hard not to notice is just amazing.
What I find surprising, older people vote. They wield most of the political power in America. Where is AARP? Where is the person earning 7 figures a year from AARP on this?
Well, AARP has a very ossified way of coming to policy. And they always do the right thing after everything else. So they come to the right policy about 10 years late. And, maybe that's going to have to be okay. But the people at AARP agree with me that this is very urgent, but they say that it's more urgent to, first off, stop pharma, which they did a little bit of this last round, and to rescue Social Security. Well, I can't argue with that. I mean, we do have to rescue Social Security, but surely we can do 2 things or 3,
right?
But I mean, these incredible arguments over abortion and immigration, which are going nowhere and completely crowding out dealing with this coming crisis. I mean, I can tell you today that in 12 years, we will have enormous numbers, millions of elderly people homeless and without shelter or food if we don't do something.
In the richest country in the history of civilization.
And where was it in the last election? Where was any mention of elder care in the last election? None. Not polled, not asked of candidates. I mean, this is one in which if 1,000 people contacted Congress each week on this issue, Congress would act because no one has asked about this before. People keep thinking that it's a family thing. It's just lightning hit my family. No. This is built into the way we now live. The fact that we live into old age and we have not developed ways in which people can save money means that we will underpay care workers. We will have miserable nursing homes. We will abuse hospice, and we will still have millions of people on the street.
But the CEOs of United Healthcare will be worth billions.
Sure, they will. And I mean, United and Humana do have their little innovative projects here and there. But, I've been working on catastrophic long-term care insurance that would pick up after a substantial waiting period. So if you were the middle American earning the middle American salary, you'd wait 1 year and 10 months before the federal coverage would kick in. You would be obliged to have saved, raised enough children, bought insurance, whatever, to cover that upfront cost. And then the government would kick in, not to cover every single thing, but to cover, 6 hours a day of in-home care. And, that would make a big difference. And everybody I've talked with 300 people one-on-one. They all agree that this is the right policy and should have been enacted 40 years ago. And I can't get a sponsor in Congress now. I mean,
how
it's a
many
crazy situation?
How many people in the House of Representatives signed on to the bill that you helped to write that Congressman Suozzi was promoting? Zero.
Suozzi alone.
Oh,
Because Biden said he would not impose any new taxes. And the way we wrote the bill, it's a 0.3% wage tax, because that's what people can understand. There are other ways to finance it, but financing it in the way you finance Social Security is sort of the most understandable.
That's the problem.
0.3%, that means that on a income of $100,000, you'd be paying $300 a year for this catastrophic coverage. $300 a year on a $100,000 salary. Your employer would pay $300 a year. And you build a trust fund that could actually pay for catastrophic care. It makes very good sense. It saves Medicaid. There are other things that need to be done. I mean, we need to pay the aid workers, a reasonable salary. We need to stop infections in nursing homes. We need to build many more housing that people can live in when they're somewhat disabled. There are 20 such things that need to be done, but none of it can be done in a sustainable way unless we pay for it. And right now, there is no way to pay for it. It depends entirely on Medicaid, and there's no state, not even New York and California, that can simply double their Medicaid budget.
How does this compare to other countries? Canada?
Other countries have taken long-term care as part of their medical care system from the start. So Canada covers long-term care. All of Europe covers long-term care. Even third world countries cover long-term care. Now, they don't have nearly the number of elders that we have, but yeah, I mean, they've just built it into their healthcare system. But I mean, I wouldn't want to actually put long-term care into our healthcare system. The people are too used to making huge amounts of money. Meals on Wheels gets a meal out to people at an average nationwide of $7 a day for 2 meals a day. I don't know a doctor who can think about having a $7 a day supper, much less delivering it to the home and having 2 meals.
Now, Meals on Wheels was one of my mother's favorite charities. Does that pass your muster?
Yeah. They do good work. And not everywhere is it called Meals on Wheels, I should say. I mean, it's the home delivery of food, and it can come under a bunch of different names. But
there are waiting lists, for that kind of service in places all over the United States.
If you want to have your blood boil, Google more than a meal, just put it in quotes, and you will come to a research project done by Brown University, in which they recruited 6 cities that had more than a 6-month waiting list for meal delivery. 6 months or more to get food. And then they randomized people into 3 groups. One group got Meals on Wheels. One group got food delivered by UPS and a microwave. And one group got nothing. And much to your surprise, people do better with food than without it.
Let me write that down. So we want.
And not only that, they do a little better to have a friendly neighbor stop by with the food. But how in this country could we have randomized 1/3 of the people to get no food? I mean, it makes my blood boil. Now, they weren't getting no food. They were, getting a neighborhood kid to run down to the 7-Eleven and get them, Coke and a sandwich or something. But they were getting miserable food in an uneven way, and, not a good, healthy diet. So, why isn't that a scandal? How could we in this country have 1/3 of the kids and 1/3 of the elderly unable to count on having food? We are, the divide between the haves and the have-nots have just become so severe I've been going to my fellow geriatricians saying, do we actually want to be the people who can write for $20,000 a day or a month drugs for people who can't get supper? We should be raising holy hell because we don't want to be the ones who have to keep doing that. Anyway, that's my pitch.
Why aren't the medical schools? Why aren't the doctors? Why isn't the AMA? Ultimately,
I mean, much to their credit, the American College of Physicians did endorse the bill and has it as one of their priorities. American Medical Association is so deeply entrenched in self-protection that they just don't get around to being concerned about their patient population.
But the CDC, the AMA.
The CDC doesn't deal with old people.
But
the CDC deals with infections and tragedies. The CDC has very little, I mean, they have very little money. And they just, I mean, they for a long time, they had nobody dealing with elderly. Now they have a small group dealing with dementia.
What I'm saying is, why can't a Surgeon General declare for-profit health insurance a health risk more dangerous than cigarettes?
Good question. I don't know. Talk to the Surgeon General. I mean, it isn't really that it isn't really just the for-profit. It's also, I mean, because there's some really awful nonprofits and there are some really decent for-profits, but it's more the mindset that you can't deny a person, you know, the latest, greatest hotshot drug, but you can walk away from them not having food and housing. You know, I mean, we have made medical care just an infinite entitlement and have forgotten that you probably need food and housing first. You know? And at the time we made Medicare an open-ended entitlement, the country was rich. We didn't, and the divide between the haves and the have-nots was not nearly so severe. We have thinned out the middle class. So we now have lower middle class and poor and upper middle class and rich. Not very many kind of just decent middle class jobs anymore. So, you know, the steel workers are not very much anymore. The automakers are not very much. So we've lost the sort of anchoring center that we had in 65 when we passed Medicare. I mean, that was a difficult time with the war and all, but we still had a sense that we were all in it together.
Yeah.
And now the rich are very skilled at walking past the person on the street.
Mm-hmm.
And not even, I mean, even if you, as a matter of principle, don't just sort of reach in your pocket and hand out money, you don't even vote to try to reduce that risk. You don't see it as part of your job. You know, we need to be reminding people that we used to all get together to raise the barn, you know, I mean, right. And here we need to all get together to find ways to support long lives.
At the beginning of this segment, the Reverend Barry W. Lynn said, you turn on the news and they talk about horse racing the next election, but not what's really important. They will talk about anything except what has to be talked about. Medicare for all, free healthcare, free drugs, free
guaranteed housing and food. I mean, if you can't, for 99% of your population, get people in housing and food, you're really failing. Most European countries do not have substantial homeless populations. Singapore, of all places, in 1984, started requiring that all residential housing, newly built or major renovations, had to be disability adapted. All. So now they have no problem finding a place for somebody who has to use a walker or wheelchair. But we don't even have that on the agenda. We don't even know how to talk about it. As you were saying earlier, lots of people think Medicare covers this until their family goes bankrupt. And then they think it's their personal tragedy.
Yeah.
They don't think that, no, this was the way the society's built.
What did I do wrong? What did I do wrong? They blame the victims. You should have planned for this.
Well, or, you just had very bad misfortune. It's sort of like, having bought the wrong stock and having it go belly up or something, having put all your money in cryptocurrency right now, I guess. But I mean, people still think of it as their personal tragedy, not that, no, actually, we built it to really nail you. And we need to change that. If everybody listening to you would write a letter to their congressman and their senator asking their position on how to finance elder care, the first 20 won't get any, they'll get a mealy mouth, we're thinking about an answer. By about 20, they start looking for answers.
Well,
there are good answers.
I think what we need to do on this show is select specific Congress people who sit on specific committees and write to them, not so we don't dilute. We're a small little show. So
sure,
we don't want to dilute.
Finance or the Health, Education, Labor, and Pensions Committee in the Senate. And in the House, it's Ways and Means or Energy and Commerce. And, find out who in your area is on Energy and Commerce or Ways and Means. And on the Senate side, Finance or HELP, the Health, Education, Labor, and Pensions. And you're right that it's better to push those guys. But what we really need is for it to be inescapable in our media. That, the poll about, what issues people are upset about includes the costs and burdens of long-term care. And we asked this, we've got some funding and paid for it in the 2016 election and showed that it was a latent terror for most voters, the costs and burdens of long-term care. And it didn't matter if you were a Clinton voter or a Trump voter. The rates were almost equal. That people thought that this was very important, that it was very much on their mind and so forth. They just hadn't turned the corner to make it political. It was still personal.
Yeah. So before you go, and this was great, and thank you, and please come back. And I just want to thank the Reverend for bringing you on.
Absolutely.
And I want to thank the Reverend for keeping it clean.
Yeah.
Except for the monkeys. The monkeys are doing
the monkeys. I didn't plan well, or I would have had a better background here, one that gave the appearance that I was in a resort in the Gulf of Mexico, but I didn't have time to change it.
I should mention the Reverend Barry W. For nearly a quarter of a century, ran Americans United for Separation of Church and State. He is both an ordained minister in the United Church of Christ, and he's also a lawyer, member of the Supreme Court Bar. And this question is for you. When you look at most of the major problems in this country, including this one, it's greed, right? It gets down to greed.
It absolutely does. And when people want to talk about how to deal with inflation, they ought to look very, very carefully at the inflation of corporate bigwigs funding and the paucity of increase in what they pay their workers themselves. I mean, it is a scandal. It is almost never talked about. When the Republicans criticize Biden for having inflation increase, and you ask them, well, what would you do? They can't tell you. They wouldn't have an answer, because all the fat cats that give them those millions of dollars to run the next time would be disadvantaged if Republicans told the truth and said inflation is almost all about greed. And there's something in every religious tradition and throughout humanism that says greed is evil. Greed is a really bad thing. And we ought to get back to that.
Yeah. This is the last time I'm going to say this year. 1/3 of inflation, 1/3 of inflation is rent.
Yeah.
1/3. And half the people who rent live at or below the poverty line.
Yeah.
So whatever you're watching that passes for news, you're not being told what's important. The article in the New Yorker is written by who?
A woman named Ava Kaufman, Kofman, and it talks about a lot of very specific cases that have gotten very little national exposure. This is really a blockbuster article. This is the kind of thing that they should be talking about on every conceivable network talk show. I don't know. I'm going to ask Joanne. I don't know that this woman who wrote it has been on any television shows.
Well, bring her on. Bring her on my show. It won't break her record. She still won't be on it.
No.
She did.
Well,
She did a remarkable job of investigating this, following leads and networking. It still doesn't tell us sort of what proportion of hospice programs are behaving so badly, but it does show that a reasonable investigative reporter could find lots of examples pretty quickly. When I first started in hospice in 1978, we were very concerned we had prosecutors who were looking to prosecute us for homicide. So we were documenting everything. We were very careful. We went out to see patients in the middle of the night, burial attest for how many times I got up at 3 a.m. to go see some patient, that the nurse was nervous about. And boy, now doctors want 9 to 5s, and they leave nurses, hanging out there in limbo, and or aides, even, not even a nurse, but just an aide, dump lots and lots of work on the family, leaving the families feeling very scared. We would never have allowed a family to feel scared. I mean, I used to give families my beeper number and said, if you have time, go through the regular process. But if you're really scared, just call me. I talked once at a conference about not using feeding tubes for people who stopped eating. And the prosecutor for Long Island stood up and said, if you were in my jurisdiction, I'd prosecute you for murder. It ruins your day for a prosecutor to say that what you're doing and talking about publicly, he would consider murder. So we were very careful. We were very thoughtful. We were rather missionary, and we could do anything. I mean, it was amazing. We could get airlines to give us tickets so that some guy could go home and see his mother before he died. I mean, the amazing stuff we did. But now it's just a business. It's just a business. It takes care of half of the Medicare people who die. The executives of those companies are making money hand over fist.
This country doesn't know right from wrong anymore.
No, it does not.
Reverend Barry W. Lynn, for a treasure trove of his appearances on radio and television shows and his writings, go to barrywlynn.com and follow him on Twitter. His handle is barrywlynn.com. And why don't you say goodbye to our very special guest for us?
Oh, but first I get to say, because he hasn't, that remember that his books are coming out in the spring. Paid to piss people off. His memoirs of fighting porn or defending porn, fighting the draft, and keeping religion out of government. So
I can't wait. I cannot wait to read it. I cannot wait to read it.
Thank you.
Thank you, Reverend. Stay at
Absolutely. Only good trouble.
And wrap up with the good doctor. How do people contact her?
Yes.
I have 2 websites. One's called medicaring.org and the other is drjoannelynn.org. The Dr. Joanne Lynn one deals mainly with the financing of long-term care. The Medicaring one is much more general and has some briefing papers on how to go about talking to legislators. My email is disarmingly simple, drjoannelynn@gmail.com. And just DR. And my name is correctly spelled Joanne and LYNN. So, it's right there on the screen.
Yeah.
So, yep. So if you're willing to annoy your congressperson or your senator, please be in touch and have a look at drjoannelynn.org. It'll teach you all you need to know about how to contact your senator or your congressman or both. And, we've got to raise our voice.